infectious disease expert from the PIIC Center, Dr. Donna O'Neill. Good morning.
Good morning.
Welcome back.
Welcome back.
Thank you. Got a little welcome back gift for you guys.
Oh, welcome
I love
back, gift.
presents.
After your, is it real or not real? I don't know. Do you do some of the shopping at your house?
He does.
Oh, yeah, I
Just
do.
enough to put in this reusable. This is
Wow, these are
Little
nice.
springy bag.
this is nice.
And then
This will hold
Then you
some
pull the
stuff.
thing down.
Perfect.
And yeah.
Oh,
Thank you.
Yeah.
And there's even
an ad.
an
Yeah.
advertisement in here for the PIIC Center. I like
Yeah.
that.
I like that. When you go shopping for an infusion provider,
You've picked the best.
Thanks,
Well,
guys.
we're probably not going to be able to put any of those real or not products in here.
That was fun.
oh look, it just collapses.
Yeah.
You move, the bottom slides up and it instantly collapses.
I might be able to fit one of those in the back of my golf cart and
Oh,
So
thanks.
before you get me off topic, I wanted to talk about Evusheld the last time and we didn't.
Okay.
And I've been somewhat scolded by a colleague that we've done a bad job or a poor job educating people on it.
Who's this colleague? I don't know.
I-
All right,
I
so
won't
this
tell.
is a drug, a treatment.
So, your wife's observation that some people are wearing masks, in the airport, it's probably our immunocompromised patients. And it's 7 million of the US population. And it's either those people who are immunosuppressed or people who live with them. So this is the group of patients who have weak immune systems. So at the top of the list are organ transplant patients, because there's quite a variability within this group. Then it includes cancer patients. Now these are people who are actively being treated for cancer. So it's not if you had cancer 5 or 10 years ago, it's for people who are actively on treatment. Then there's a big group of patients on a group of drugs called biologicals. And these people, these are from rheumatologists, gastroenterologists. These are drugs that weaken their immune system and make them susceptible to COVID and other infections. People who are on long-term steroids, for example, 20 milligrams for 2 weeks, that puts you into this category. My HIV and AIDS patients, especially if they're not doing well, they're in this group. So it's quite a large group, and I think we've forgotten them. And I think some of them might have misconceptions because, when the vaccines came out, they weren't studied in immunosuppressed patients because we don't expect they'll have as good response to them as other people. But they still get a response. It may be 10 to 20% less, but they still get a response. But when they hear this, a lot of them just don't go and get vaccinated. These are the people that, when they get sick, they were prioritized to quickly receive the monoclonal antibody or the drugs that we have for it. So now there's this product that's to be used in conjunction with the vaccines called Evusheld, and it's a long-acting monoclonal antibody that will give them extra protection. Again, it may not prevent them from getting the infection, and I think we have to get away from that. I mean, the goal of all this is to decrease the risk of hospitalization and decrease the risk of death. So it's 2 long-acting antibodies given intramuscularly. Unfortunately, it's usually in the derriere.
I was going to ask, is it a pill?
It's an injection. And until recently, it was in very short supply. So these people would actually put their names in a hat and they would be drawn by lottery to get it.
Oh my.
And only healthcare systems received it from the state. But I think we're getting a little behind in giving it out to people. So the state reached out to the PIIC Center, and we also have a supply.
Nice.
So as when I was calling some of the doctors who have these at-risk patients, they were the ones that said, nobody knows about this stuff. So I wanted to get it out there. It's one more thing in our armamentarium for COVID. So if you have one of those conditions, either call us directly, call your doctor.
Is it one injection or is it a series?
So when it first was released, unfortunately, they decided when the Omicron variant came out, they needed to up the dose. So we're not sure if it's going to last for 6 months, 3 months. We're still looking into it. So like everything else with COVID, it's been released by the FDA under that EUA, Emergency Use Authorization. And we'll see. It's one more thing. So if you were with someone at Easter and now they're calling you to say, hey, I got COVID, this is not for you. It's not to be used for post-exposure prophylaxis. It is to be used for pre-exposure prophylaxis. So one more thing. The monoclonal antibody, probably 2 weeks before spring break, we started to be giving it again, and we're going to wait and see after Easter if the numbers go up. It's a different one. They keep changing because of the variants. And this one's a little easier to give. It's given by an intravenous push, but you still have to wait there for an hour for side effects. And we all kept saying this is useless, but sure enough, last week we had somebody who got hives. And there's a new drug that just got out of phase 3 trials that's kind of unique. It's an antiviral, and it's a drug kind of like a steroid to work on your immune system to damp it down. So I'm looking forward to that, another drug in our shopping cart. One drug that we haven't used a lot of, but we probably should, is the Paxlovid drug. So the key to all these, therapies is you got to get them in quickly. So within 5 days of getting sick, you need to get this drug. You only take it for 5 days. It's oral. There's a few more pharmacies where you can get it. Before it was just Meyer, but there's a few more now that have come online. But again, the key is to do it quickly. And this drug, the only downside of it, it tastes terrible, I'm told. But there are drug interactions. But I think we've maybe overemphasized that, and some of them you can work around. So like one of them are the cholesterol drugs. Well, hey, you just stop the cholesterol drug. No one's gonna die of high cholesterol in 5 days. So there's new things coming out all the time. I get lots of questions about booster doses.
Well, let's talk about that because tomorrow there's a booster.
You're getting one,
I'm
right?
going tomorrow to Brown's
Good.
at the Napoleon Fire Department.
Good.
Is that a good idea?
Yes.
This will be my second booster. So I've had the 2 first, Moderna, then the 1 booster, and now another booster.
So even backtracking a little bit, for these immunosuppressed patients, their vaccine schedule is different than everybody else's. So you had 2 doses for your primary series, and then you had a booster. People who have weak immune systems, they get 3 doses for their primary series, and then they get a booster dose. And now they can actually get another booster dose. So you're looking at 4, and a lot of these people have had 5 doses or will be getting 5 doses of the vaccine. So if you're immunosuppressed, make sure you're up to date, on your vaccines. So lots of confusion and controversy even within the medical community about it, and I get confused, so I feel bad for everybody else. When you look at the US, 20% of people are not vaccinated, and I don't think we're going to change their minds.
Yeah.
There are a lot of people I've noticed when you come into my office where 30% have had only 2 doses. And I've been pleasantly surprised when I ask them if they want to get their booster dose. I don't think I've had one person turn me down. And mind you, if you're coming to my office, normally there's something wrong with you. So,
There's so many people that might have got the first 2 doses, and then we've been talking about like their over it syndrome. So it's almost like you have to reach out to these people and get them back in, it seems like. Certain part of the population at least.
So I think we can be more precise with our recommendations. So a lot of the data came out of Israel, and you have to look at that very carefully. Again, I think we have to get away from looking at it's going to prevent us from getting sick. The goal was initially with these vaccines is you don't want to die from it, and you don't want to end up in the hospital. And the vaccines are still doing that. And that effect is persisting past 6 to 8 weeks. So, but I think we should focus it on people who will get the extra benefit from it. So it's all the people who, early on were getting the monoclonal antibody because they were having poor outcomes. And unfortunately, the biggest risk factor is age. So in the US, it's 50. Greater than 50, they've approved it. But in Canada, where you all know my mother lives, it's greater than 65. So if you're at risk for a bad outcome, you're immunosuppressed, over the age of 65, morbidly obese, people with asthma, diabetes, these are the people that I strongly encourage to go get their second booster dose. It's 4 months at least after your first booster, And I think the problem a lot of times is it's inconvenient. I mean,
It's called booster. People look at it, it's like, oh, do you want me to top that off? Can I add, you want a little more? It's like extra. We don't, if it's nice if you get it, but it's, yeah, maybe it needs a new name. We're with Dr. Donna O'Neill from the PIIC Center. More with Dr. Donna after this.
The PIIC Center is an independent practice that has provided care to the Jackson area for over 25 years. Doctors O'Neill and Cack supervise antibiotic infusions, as well as those for many other conditions, such as inflammatory bowel, joint, and lung disease, anemia, and multiple sclerosis. Our modern facility is open 7 days a week, and the infusion staff will make you feel right at home. Let your doctor know you have a choice where you receive your next infusion. Remember, when you've picked us, you've picked the best.
Come along with JTV and Experience Jackson and get to know or reintroduce yourself to some of the best Jackson County has to offer. Join Andy and Rachel as they tour the county interviewing and highlighting Jackson on a visit with Experience Jackson. Whether it's golf, museums, hotels, or events, we'll give you some great ideas on how to spend time in Jackson. Watch on jtv.tv, YouTube, and Experience Jackson social channels.
Collins Brothers floor covering, because new carpet is like, very nice. But commercials suck. Don't change the channel, change your carpet. Collins Brothers downtown, excellent. Established in 1940.
That's before the war, sucker.
The library? Oh, it's not for you. Sure, there's not much to choose from. The library is behind the times. And if you forget your book, forget about it. Oh, but when you're on the go, the library's a no-go. Students, stay at home. Although, there is an awful lot going on there. Even yoga. Actually, the library really is so much more than you think. Jackson District Library, a place to discover.
At Blair's Car Care, honesty and customer satisfaction have always been the most important thing for us. We have been serving loyal customers in Jackson County for almost 100 years. We do auto repair of all sorts, including tires, alignment, brakes, oil changes, and much more. For more information, please call 517-782-8116 or come stop by at 2424 Wildwood Avenue and experience for yourself what makes Blair's so special.
Home is just not a place, it's a feeling. The Jackson Friendly Home is a nonprofit licensed home for elderly women who are 55 and older. We provide a high-quality lifestyle for ladies who are not able to completely take care of themselves. Our team takes pride in the care and support we offer to each other and every resident. We provide daily housekeeping to assure every private room stays warm and inviting. Our skilled dietary staff excels in providing 3 gourmet meals a day as well as an evening snack. Here at the Jackson Friendly Home, we have tons of exciting events for our residents. Bingo is one of the many exciting things we do, and our ladies are quite the pros. Holidays are deeply important to us, from decorating cookies, karaoke parties, dressing up and taking photos, and much more. We love and cherish sharing laughs and making memories. Our resident care office is a very important department here in the home. They assist with daily hygiene, dispensing individual medications, set up and transport ladies to appointments, and so much more. Our team is passionate and dedicated to providing all women not only a perfect place to call home, but also a place to become part of the family.
Registration is now open for Jackson YMCA Summer Day Camp. The camp is about learning skills, developing character, and making friends. Every new experience at day camp is a chance for kids to stay active, address gaps in learning when school's not in session, and have fun. Open to ages 4 to 14. Sign up for just 1 week or all 10 at jacksonymca.org.
Welcome back. We're with Dr. Donna O'Neill from the PIIC Center. And Dr. Donna, you brought a couple charts along.
well, this might help you decide, when to get a booster.
Okay.
So the other question while you're showing it is I get asked a lot about mix and matching vaccines. So I'm not averse to the idea.
Okay.
And again, I think we can be more precise. So if you want to show the first, it's the map I show every time
Oh
I'm
my
here.
gosh.
No, not this one.
There it is.
Oh, there we are.
Well, no, it wasn't
not
that one either.
either.
It's the one of the U.S. with the dark red and the gold. I think the last time I was here, the whole U.S. was in low risk.
I don't think we have that one. I
You
think
don't
we just
have
have
that
these
one?
two. No.
Okay.
That got lost in,
there is
in the
dark red.
transfer.
Well, so the first map was to show that initially all the U.S., I think when I was here the last time, was low.
Okay.
Now we are moving up, and including Michigan. We're not as bad as New York, but we've moved up a bit. And then the other thing I wanted to show was the variance and how fast, it changes. This is the one. So you can see the pink, the BA2, how quickly it's taken over. Not surprising, because this is what we saw in the UK and other countries.
How do we know? I mean, when we get tested, are they?
No, you don't know. No. I think there are some clinical differences. And this is to show we're in region 5. And it's the pie diagram underneath our state, just to show that, most of what we're seeing is the Omicron BA2 variant.
That's the pink.
Yeah.
Wow.
So, everyone wants to try to time it. I don't think you can time this virus. So if you're waiting for a big wedding or
Yes.
we're always behind it. So we got to get ahead. It's here,
Yeah. It's like we're trying to hide from it before a big event.
Yeah.
Andy is going to be in a 600-person wedding.
It's 500.
500-person wedding.
But I'm in the wedding, so I have greater protection because I won't be
you'll
with
be
the
behind
commoners.
You'll be behind the red velvet robes.
I will be, yes.
But I want to talk about something other than COVID.
Can I try and pronounce it first?
Sure.
Men in Coca-Cola.
So some people might have heard, I actually had a question yesterday about this. This is what's precipitated this little segment on the meningococcal outbreak in Florida. So there's two actually going on, one amongst the college students and then one amongst the HIV gay male population.
And this is a bacterial disease?
This is bacterial. You've done your research, Andy. But it's the one where maybe, 15, 20 years ago, we would get out on the college campuses, and now it's part of your child's regular immunizations. The thing about this disease is overnight. People go from feeling well to being near death. And there's nothing too early on clinically that tells a doctor that they're dealing with this. So you get fever, headaches, stiff neck, and then quickly you get confused, nausea, vomiting. Sometimes they are sensitive to the light, and then you can get this devastating, blotchy, purple rash that can come on, and organ failure. So the scary thing is it happens rapidly. It's not transmitted as well as COVID. You have to have sharing of secretions, so kissing and sharing drinks, being in bars, for a couple hours at a time, that increases your risk. So again, there are vaccines. And some people, if they travel to Florida, might want to consider getting their meningococcal vaccine.
Another reason to not go to Florida.
You're going to Florida, and you do travel to Florida, So I don't know why you say that as much as you do.
So again, there's treatment, and if you get exposed, some people get chemoprophylaxis, and unfortunately we're getting resistance in this bacteria, which we never heard of before. And I know you had someone on from the health department talk about the rise in STD, sexually transmitted diseases. There's also hope that this vaccine may protect people against gonorrhea, which is getting hard to treat. So I wanted to do something non-COVID for a
more than
change.
COVID out there, that's for sure, right?
Well, the problem with that is who's going to want to stand in a gonorrhea vaccine line?
Well, that's a very good
I'm
point.
just saying it's, we have trouble with resistance. This is going to be another way to deal with it, because there are very few antibiotics that are being, in R&D because, there's no profit for it.
When
so we're in
people
trouble.
get that, they don't post on Facebook that they need prayers. They don't tell anyone.
Stickers. Are you going to wear a mask on the airplane?
Yes.
There you go.
Yeah. So we'll see if that gets reversed.
Yeah.
Thanks for coming in.
Thanks for having me.
Thanks
Thank
for the
Yes.
shopping
Gonna put it to good use today.
From the PIIC Center, Dr. Donna O'Neill. We're going to meet the new superintendent at Jackson Preparatory and Early College after this.